Good evening, I am Martina Orlandi from the University of Modena and Reggio Emilia. We are here in Bordeaux attending at the USTAR lab course on systemic sclerosis. It's a really pleasure for me to be here with Professor Zsuzsanna McMahan from the University of Houston, Texas. And please, Zsuzsanna, can you tell us something about how to stratify systemic sclerosis patients regarding the GI involvement?
Sure, that's such a great question. We have actually recently completed a study where we evaluated a cohort of about 2,000 patients from the Johns Hopkins Scleroderma Center, and all of the patients had longitudinal follow-up available on their GI severity status. And we were able to identify 4 distinct subgroups of patients within this group that were differentiated both by clinical risk factors as well as temporal progression. So we found that there was an early progressive group where they started off with low GI severity, but in the first 5 years they progressed to more severe GI disease. Then a group that started off very quickly with more severe GI disease, and a third group that progressed much later. And interestingly, that group had much more severe vascular manifestations of the disease and was more enriched for women, whereas the first 2 groups had more men and more fibrosis or more severe myopathy. And the 2 early progressive groups were enriched for antibodies to RNPC3. And this was really exciting for us. And these groups were very different from the patients that remained stable, which was the largest group of patients. And so it's very important as we see these patients in clinic to understand which ones will progress and which ones won't, so that we can treat them appropriately.
Really interesting. Thank you.
Thank you.